Many of us experience stomach discomfort from time to time, but some seemingly common stomach conditions can, over time, evolve into something far more serious: stomach cancer. Understanding these precursor conditions is key to early detection and prevention. These conditions don't guarantee cancer will develop, but they significantly increase the risk, acting as warning signs that demand attention. By recognizing them, we can take proactive steps to monitor our health and make lifestyle changes that can potentially halt or reverse this dangerous progression. The journey from a healthy stomach to a cancerous one is often a long one, marked by several distinct, identifiable stages. One of the most significant risk factors is chronic gastritis, a long-term inflammation of the stomach lining. This persistent irritation can damage the stomach's protective layer and, over many years, lead to cellular changes. Frequently, this condition is caused by a common bacterium known as Helicobacter pylori. While H. pylori infection is widespread, in some individuals, it triggers a chronic inflammatory response. Left untreated, this constant inflammation can alter the very nature of the stomach cells, a process that can ultimately pave the way for cancerous changes to begin. It's the persistent, unresolved inflammation that creates a dangerous environment within the stomach. This cellular alteration can lead to a condition called intestinal metaplasia. This is a specific state where the normal glandular cells lining the stomach are replaced by cells that more closely resemble those found in the intestine. While intestinal metaplasia is not cancer itself, it is considered a significant precancerous lesion. It signals that the stomach environment has been altered so profoundly that the cells have changed their identity. Certain types of this metaplasia, known as incomplete metaplasia, carry a higher risk. The presence of this condition is a clear indicator that the stomach has undergone substantial stress and damage. Another area of concern involves gastric polyps. These are abnormal growths that protrude from the inner surface of the stomach lining. The majority of these growths are benign and pose little threat. However, certain types, particularly adenomatous polyps, have a higher potential for malignant transformation. The risk associated with a polyp is determined by its size, type, and cellular characteristics. Larger polyps and those identified as adenomas are often removed and examined to prevent them from developing into cancer. Regular monitoring is essential when these growths are found. A more advanced stage of precancerous change is known as dysplasia. This term describes abnormal development and disorganization of cells within the stomach lining. When dysplasia is present, the cells are not just inflamed or changed. They are growing in an abnormal, disorderly fashion. It's a clear signal that the progression towards invasive cancer is much more likely. Dysplasia is typically graded as either low-grade or high-grade. High-grade dysplasia is considered a direct precursor to stomach cancer, representing the final step before cancerous cells begin to invade deeper tissues. Beyond these specific medical conditions, several lifestyle and environmental factors can significantly escalate the risk of stomach cancer. These factors can act alone or exacerbate the progression of the precancerous conditions we've discussed. A diet high in salty, smoked, or pickled foods has been strongly linked to an increased risk. Similarly, chronic tobacco use and excessive alcohol consumption are known contributors that damage the stomach lining. Furthermore, obesity is recognized as an independent risk factor that can promote inflammation throughout the body, including in the stomach. Understanding these stomach diseases and their potential to become cancerous is crucial. Regular medical checkups and screenings are vital, especially if you experience chronic stomach issues, have a family history of stomach cancer, or possess other risk factors. Early detection through procedures like endoscopy can identify these precancerous changes when they are most treatable. Maintaining a balanced diet rich in fruits and vegetables, avoiding smoking, limiting alcohol intake, and managing a healthy weight are powerful preventative steps. Ultimately, vigilance and proactive lifestyle choices are your best defense in safeguarding your health against stomach cancer.